Welcome to the Guide Me MD podcast, the audio-first platform designed to bridge the gap between textbook pathology and real-world ward survival. My name is Alina.
And my name is Lina, and we are the founders of the Guide Foundation and your hosts for our very first episode of the Guide Me MD podcast.
Before we step onto the ward, a mandatory medical disclaimer. This podcast is strictly for educational purposes and does not constitute medical advice or a clinical consultation.
Every case we discuss is 100% simulated and fictionalized with no real patient data. If you're experiencing a medical issue, please contact your healthcare provider or head to your nearest emergency center immediately.
We know the ward can feel like a storm, but you don't have to navigate it alone. Trust the compass. Your ward survival starts right here.
And let's get right into it. The team is waiting at the nursing station for segment 1, the handover. You are an intern, Alina, covering the emergency department, and you've been handed the chart for bed 4, a 72-year-old female presenting with worsening shortness of breath and a severe cough.
The triage nurse reports her blood pressure and heart rate as stable, but she has a fever of 38 degrees Celsius and her oxygen saturation is sitting at 94% on room air. The clock is ticking and we need to lock down a structured history to rule out respiratory red flags before the attending rounds.
Take a breath, grab your pen, and let's step behind the curtain. Welcome to segment 2, the role play.
Good morning. My name is Dr. Guide. I'm one of the emergency doctors on duty today. Before we begin, I just want to confirm, would it be all right if I asked you a few questions to get a better sense of what brought you in today?
Of course, doctor. Anything to figure this out.
Thank you. Could I just confirm your full name and age for my records, please?
My name is Lina and I'm 72 years old.
It's nice to meet you, Lina. I can see from the triage notes you've been experiencing some trouble with your breathing. Could you tell me a little bit more about when this started?
It was a bad cough for about 6 months now, but the last 3 days, both the cough and my breathing have just gotten so much worse.
I'm so sorry to hear that. Let's talk a little bit more about the cough first. So, Lina, when you cough, would you say that anything comes up?
Yes, it's usually just a little bit of white stuff that I end up coughing out.
Okay. And Lina, would you be able to quantify the amount that you're coughing out?
Maybe 1 or 2 teaspoons a day.
Okay. And have you noticed that it has changed color recently?
Yeah, for the past 3 days, it turned a little bit thicker and turned a little bit more green in color.
Okay, that's a very important detail. Lina, have you noticed maybe any streaks of blood in it or any, let's say, foul smell coming out of it?
No blood, gosh, and no bad smell either.
Okay, I'm glad to hear that. Lina, have you noticed that the cough is worse at any specific time? Like maybe you feel it the most first thing in the morning or when you lie down at night?
No, it's pretty constant throughout the day.
Okay, I see. And Lina, have you ever experienced these symptoms before?
Oh, this is the first time it's been this bad.
Okay, you mentioned that the breathing has gotten worse over the last 3 days. To give me an idea of your baseline before this week, how far could you walk before feeling breathless?
Usually I can walk to my book club, which is about let's say 500 meters away. But lately, I had to stop halfway and rest for a few minutes before I can keep going. It's been such a struggle.
I'm so sorry to hear that, Lina. I imagine that's extremely troublesome. I want to ask, how much would you say that's changed in the last 3 days?
It's terrible now, doctor. I'm short out of breath, even when I'm just sitting in my chair. I haven't been even able to climb up the stairs to my bedroom. I've been sleeping downstairs on the couch.
My, I can hear how difficult this has been for you, Lina. Since you've been sleeping downstairs, I just want to check. Are you able to lie completely flat, or do you find yourself needing to prop up on several pillows just to be able to breathe comfortably?
I can lay down flat just fine. It's just really climbing the stairs that stops me from going to my actual bed.
Hey, and do you ever wake up suddenly in the middle of the night feeling like you're gasping for air?
No, no, thankfully not. Once I'm asleep, I stay asleep usually.
Okay, I'm glad to hear that, Lena. And have you maybe noticed any whistling or wheezing noises coming from your chest when you breathe?
Yes, actually, there's a constant whistling sound. It doesn't seem to matter if it's day or night, it's just always there.
And would you say anything makes your breathing a little easier? For example, does leaning forward help? Or maybe resting your hands on your knees or using any inhalers?
Changing positions doesn't really help, but now that you mentioned inhalers, the doctor has given me a puffer a few years ago, but it didn't cure the cough at all, so I just threw it away.
I see. Do you by any chance remember the color of the puffer?
I believe it was a blue puffer.
Okay, we're definitely going to revisit that, okay? The nurse also noted that you have a bit of a fever today. Have you felt hot or had any cold chills at home?
Yes, I've been feeling so feverish since 3 days ago, and I even checked it with my thermometer at home, and it was 38 degrees.
I see. That must have been so troublesome for you, Lena. Alongside with the fever, have you experienced any, would you say, drenching night sweats?
No, no, not night sweats.
Okay. Have you noticed any unintentional weight loss recently?
No, my weight has stayed exactly the same.
Okay. And how about your appetite? Have you noticed a significant decrease in how much you're eating?
My appetite is pretty much the same as always, doctor.
Okay, I'm glad to hear that. I also just need to ask a few questions to rule out other causes for your breathing trouble, like heart issues or blood clots. Have you had any chest pain, especially, let's say, chest pain when you're taking a deep breath?
No, no chest pain at all, thankfully.
Thankfully. And have you noticed any new swelling, pain, or redness in your calves or ankles?
No, my legs look completely normal, doctor.
Glad to hear that. Lastly, with the fever and breathing trouble, have you felt unusually dizzy, lightheaded, or confused over the last 3 days?
No, my head is clear. I'm just extremely exhausted from all the coughing and the breathing issues.
I can imagine. Have you noticed your heart racing or fluttering, or sometimes you may feel like it's skipping a beat?
No, my heart feels like it's beating normally.
Okay. And before the cough got really bad 3 days ago, Lena, did it start with maybe like typical cold symptoms like a runny nose or a sore throat? Or, in fact, were you around anyone who has been sick recently?
No, no runny nose, and honestly, I've been living alone. I haven't really been around anyone who was sick, doctor.
And have you noticed any changes to your voice lately? Like, has it become more raspy or hoarse?
No, my voice sounds the same as always.
Okay, Lena, thank you so much for answering my questions so far about what brought you in here today. I just want to delve into your past medical history for a little while, okay?
Sure, of course. Go ahead, doctor.
Okay, Lena, do you have any medical conditions that I should be aware of?
Well, I've had high blood pressure for a long time.
Okay. Do you know roughly how many years ago you were diagnosed with that? And are you taking any medications for it?
It must be at least 15 or 20 years now. I take a pill, a Ramipril, usually every morning.
Okay. Do you know the dose of it by any chance?
I think it was about 5 mg, I
Okay.
believe.
Okay, thank you, Lena. And would you say you're pretty good with taking every day, or maybe sometimes occasionally you're missing a dose?
I'm very good with that one, doctor. I take it right with my morning tea every single day without fail.
That's amazing. And aside from your high blood pressure, do you have any other medical conditions like diabetes, high cholesterol, anything else?
No, no diabetes or anything. But now that you mention it, a few years ago, A doctor told me I had some kind of chronic lung thing. I think what did he refer to it as? Smoker's lung or blocked air tubes or something. But to be honest, I didn't pay much attention to it after the blue puffer they gave me. It didn't really cure.
I'm so sorry to hear that, Lina. Do you remember by any chance how they diagnosed it? Did you have to do a breathing test where you had to blow hard into a tube?
Yes, that's exactly it, doctor. I had a bad winter cold that dragged on, and they made me blow into this sort of a machine. But like I said, I didn't go back after that.
I understand, Lena. We'll definitely be looking closely at that today. And just so we can get through your past medical history in depth, I want to confirm, have you ever had any previous surgeries or operations?
No, thankfully, I've never had to go under the knife for anything.
That's really good to hear. And have you had any previous hospital admissions or where you might have had to stay overnight in the hospital for your breathing or for any other reason?
No, never. I've always tried to stay healthy and manage things at home.
I'm really glad to hear that, Lena. So, just to confirm, you've never had a breathing flare up like this or even more severe than this in the past?
No, doctor. Like I said, this is my very first time it's ever gotten this bad.
Okay, that's a very important baseline for us. Let's briefly review your medications. You mentioned the Ramipril that you take every morning. Are you taking any other prescription medications by any chance?
No, just that one pill, doctor.
Okay. And any other over-the-counter painkillers like ibuprofen or any daily vitamins or even herbal supplements?
No, I don't really like taking pills unless I absolutely have to.
I understand, Lena. Why don't we circle back to the blue puffer you mentioned earlier? Do you by any chance remember the name of it? And at the time, did the doctor prescribe you an inhaler for you to take every morning and every night regularly?
I honestly don't recall, doctor. I believe they told me take the inhaler whenever I felt out of breath, but it never stopped the coughing. I just figured out it was useless and I threw it away. They never gave me anything to take every day, though.
I completely understand, and I appreciate you being honest about that, Lena. We're definitely going to talk about different inhalers in the meantime. However, first, I just want to ask you a critical safety question. Do you have any known allergies to any medications, like penicillin, for example?
No, no allergies to any medications.
Okay. And other than medications, do you have any allergies to any specific foods, latex, or anything else?
No, nothing like that.
Excellent. And Lena, are you up to date on your yearly flu shot? And have you ever received the pneumonia vaccine?
I usually get the flu shots every year, but somehow I just missed it this year. And I don't think I've ever had a shot for pneumonia, no.
Okay. We can certainly look into getting those vaccines updated for you before you head home. Now, I'd like to ask you a few questions about your family's medical history, if that's okay.
Of course, go ahead, doctor.
Okay, Lena. Are your parents alive and well by any chance?
Fortunately, both my parents have passed away a long time ago.
I'm so sorry to hear that, Lena. And I'm very sorry again to bring up such a difficult topic. But may I ask if you don't mind sharing what they had passed away from or if they had any long-term medical conditions?
My mother lived to a very old age, thankfully. She had an underactive thyroid, is what the doctor said, but otherwise she was quite healthy. But my father, on the other hand, he passed away about 20 years ago from lung cancer.
I'm so sorry for your loss, Lena, and thank you so much for sharing that with me. I know it's certainly not easy to talk about. Even though this is a sensitive question, I just want to ask, was your father a smoker by any chance?
Yeah, he smoked his whole life right up till the end.
Okay, that's an important detail for me to note. Do you have any siblings by any chance?
I do, yes. I have one younger sister.
Okay, and how is her health?
She's perfectly healthy, thankfully.
Thankfully, I'm glad to hear that. Are there any other conditions that run in your extended family, like asthma or any chronic diseases?
No, just the thyroid issue with my mother and the cancer with my dad.
Okay, thank you for all those details, Lena. I'd like to move on to ask a few questions about your lifestyle and your home situation, if that's okay.
Of course. Go ahead, doctor.
Thank you. It's really important I ask you these questions to help me better understand how these symptoms are affecting your day to day life and how we can best support you. So, I just want to confirm you mentioned earlier you are not currently living with anyone, correct?
Yes, I'm living alone. My husband unfortunately passed away about 5 years ago, so it's just been me.
I'm so sorry for your loss, Lena. Do you have any family nearby, like maybe your sister, or do you have any children by any chance who can help check in on you or help with groceries when you're feeling this breathless?
I do have my three beautiful children, but they all live out of town. They call, but they aren't around to help day to day, and my usually also busy. So it's just me.
I see. It must have been really difficult managing this cough all on your own, Lena, but you made the right decision in coming here today. With regards to your situation at home, we can definitely get you in touch with social services to help alleviate the burden. And if you don't mind me asking, are you currently working by any chance?
I'm actually retired, but I was an accountant my whole career.
So, were you doing mostly office work?
Yes, mostly office work, but part of my job, we had to visit a lot of other businesses and factories.
Okay. And Lena, when you were visiting these factories, were you ever exposed to any harsh chemicals, dust, or maybe fumes?
No, no, it was all clean and sanitized environments.
Okay, I'm glad to hear that. I have to ask you a few standard lifestyle questions that we ask every patient. However, they are considered more sensitive, and I do apologize if you find them offensive, but it is important that I ask so I can get the full picture of your medical history. Would it be okay if I proceed with asking?
Of course. Of course, go ahead, doctor.
Thank you, Lena. Now, I just want to ask, do you currently smoke or have you ever previously smoked?
Yes, I do smoke. It's the only unhealthy habit I have left, doctor.
I appreciate your honesty, Lena. If you don't mind me asking, do you remember at what age you started smoking?
I believe it was when I was 15 years old. It was such a long time ago.
I understand. And do you know roughly how much you smoke a day?
I would say about a pack or two, whatever gets me there.
I see. And have you previously considered quitting smoking?
Not really. At my age, I feel like the damage is already done.
I understand. It is a difficult habit to break, and we're definitely going to be talking more about this at a later date. However, let's continue on with the history taking. So, Lena, I have another sensitive question to ask you, and I do apologize in advance, but it is important that I ask. Do you drink any alcohol?
Just one glass of wine every evening with my dinner.
Okay. And I'm sorry once more for the rather sensitive question that I am about to ask, but it is just standard. Have you previously used any recreational drugs in the past?
Goodness, no.
Thank you for answering my questions, Lena. Do you have any pets at home?
No.
Okay. And have you recently noticed maybe any mold in your house?
No, no, goodness, no.
Okay, I'm glad to hear that. And finally, have you traveled anywhere outside the country recently or been on any long flights?
No, I haven't traveled in years.
Okay, Lena. Thank you so much for all of that information. I'm just going to do a quick head to toe check to make sure we haven't missed anything or any other clues hiding in your body. So I'll ask these fairly quickly so you can just give me a quick yes or no to answer these questions. Are you ready?
Yes.
Have you had any headaches or changes in your vision? Have you experienced any fainting spells?
No, never.
Have you felt any numbness, tingling, or weakness in your arms or feet?
No, none of that.
Okay. And have you had any difficulty or pain when you're swallowing?
No, no.
I'm glad to hear that. And have you had any nausea or vomiting episodes recently?
No, my stomach has been absolutely fine.
Perfect. Have you been experiencing any heartburn?
No,
Okay. Have you had any abdominal pain or any recent changes in your bowel habits like diarrhea or constipation?
no, everything is normal there.
Glad to hear that. Do you experience any pain when you're urinating?
No,
Okay. Do you feel like you're experiencing the urge to urinate more often?
no,
Okay. And have you had any episodes where maybe you urinated without meaning to, or maybe you defecated without meaning to?
No, thankfully not.
Okay, I'm glad to hear that. And have you noticed any changes to your skin, like any rashes maybe or bruising?
No rashes, no bruises.
Okay. Have you been experiencing any muscle aches or any swellings on your joints?
Just my usual knee ache from old age, but nothing new or swollen.
I see. I just want to ask you a few follow-up questions on this knee pain. Would you say that this knee pain is severe enough that it limits your walking?
No, I wouldn't say so.
Okay. And would you say the pain requires you to take painkillers regularly?
Sometimes I do take a paracetamol if it's acting up, but it doesn't really stop me from walking, like I said.
I understand. And Lena, I also want to make sure to check on your mental health. So, how would you say your mood has been recently, given everything that's been going on?
It's been a bit lonely, especially since my husband passed, and I've been really exhausted from this cough and wanting to feel a little bit like myself again.
Thank you so much for sharing that with me, Lena. It's completely understandable to feel lonely, especially when you're dealing with scary medical problems like not being able to breathe well. Grief and illness, they're a heavy load to carry, especially by yourself. I'm really glad you came here today because there's actually a wonderful medical social worker on our team who I would love to connect you with, who can help you get in touch with community resources as well as local support groups for widows. Would it be all right if I asked them to stop by later to chat with you?
I think that would be amazing, doctor. Thank you so much for offering.
Of course. I'm so happy to help any way that I can, Lena. You've been incredibly helpful answering all of my questions. Now, before I examine you and we start running some tests, I always like to understand where my patient's head is at. So, with everything you've experienced over the last few days, do you have any idea of what could be causing all of this?
I honestly have no idea, doctor. I was searching a bit online before I came in, and with the green stuff, I've been coughing and the fever. I thought maybe I have some sort of infection.
A chest infection is definitely on our radar, especially with the fever and the green color of the things you've been coughing up. Is there anything specifically you're worried or concerned about today?
Well, now that you mention it, you know how my father passed away from lung cancer, and with how much I smoke and how I can barely breathe just even while I'm sitting here. I'm terrified. I might have something serious or something life-threatening. I'm just so worried about that.
I completely understand why you would jump to that conclusion and connect those dots, especially given your father's history with lung cancer and his tragic passing. And I can't imagine how scary it must have been for you to be experiencing this. Please know that my team and I are going to do a thorough workup and we're going to make sure we have all the answers so that we can communicate clearly with you and we can figure out what's going on and get to the bottom of this. So, because we want to figure out how to best support you today, I just want to ask, what would you say are your expectations from us?
Honestly, I just want to figure out exactly what's going on. I'm so stressed out about not knowing, and I would just want to be able to catch my breath so I can sleep in my own bed again.
Completely understand. And that's exactly what we're going to do. We want to give you these answers. We're on the same team here. My immediate priority is to get you some oxygen right now to help you breathe a little better. And then we're going to get started on some breathing treatments to help your lungs relax and take some pressure off of them. After that, we're going to get a chest x ray to take a look at your lungs and get some blood tests running to see how your oxygen levels are, and maybe even get to the bottom of what's been causing this flare up. I'm going to step out to put those orders in now, and the nurse will be right in.
Thank you, Dr. Guide. I feel better just having a plan. And cut. Dr. Guide has stepped out to place the orders. That was a textbook example of gathering a comprehensive respiratory history while actively managing a patient's underlying anxieties. Now, Alina, let's step out of the ER and into the exam room. I'll be your reviewing examiner. What is your number one differential diagnosis and justify it for me?
Okay. After talking with my patient, Lina Doe, my top differential is an acute exacerbation of COPD, most likely triggered by a respiratory tract infection. My justification for this is given her massive smoking history, which is over 85 pack years to be exact, as well as her chronic baseline cough, her previous medical history using a blue puffer that was inefficient, her acute worsening of dyspnea over the last 3 days, accompanied by an increased volume of purulent green sputum, as well as her fever.
Amazing work, Lena. What else was on your differential list and how did you rule them out during your history?
Okay, so during my history, I was concerned for the most life-threatening pathologies that I really wanted to rule out. So other differentials that I considered were community-acquired pneumonia. That's why I wanted to ask about fever, chills, and confusion, just so I could be able to complete the CURB 65 score. Additionally, I also considered heart failure as a differential, which is why I wanted to ask about orthopnea, waking up gasping for air, and any leg swellings. I made sure to keep lung cancer in my differential list, given her father's history and her smoking status. I would be highly suspicious in this patient. So I specifically screened for hemoptysis, weight loss, and hoarseness, even.
Okay, that's amazing. And let's pause right there about pneumonia. You mentioned CURB 65 and examiners love that scoring. Can you break it down for me what that scoring system is?
Yes, certainly. So, CURB 65 is a scoring system used to assess mortality risk and the need for hospital admission for patients with pneumonia. The C stands for confusion, U for urea elevated, R for respiratory rate greater than 30, B for blood pressure with a systolic under 90 or diastolic under 60, and age 65 or older. So a score of 2 or more predicts that the patient generally requires inpatient hospital treatment.
Spot on. Now, before we jump in to our investigations, you have to walk in and examine her. What specific physical signs are you looking for in a patient with severe COPD exacerbation?
Okay, so in a patient with severe COPD exacerbation, I'd be looking for signs of respiratory distress, such as use of accessory muscles, pursed lip breathing, and central cyanosis. Upon closer examination of the chest, I could expect any chest wall deformities like barrel chest. I would be able to hear maybe widespread expiratory wheezes, maybe coarse crepitations from infected secretions. What's really important is that I would ask her to hold out her hands and check for a flapping tremor or asterixis, as it's called, because this is a major red flag for CO2 retention.
Excellent clinical catch with the asterixis, Alina. So now, as the examiner, I'm going to give you a blank clipboard. Walk me through your initial workup.
Thank you, Lina. I would structure my investigations systematically into bedside, labs, imaging, and special tests. So, starting off right off the bat with bedside, my main priority is in arterial blood gas. I immediately want to check for hypoxemia. I want to assess for respiratory failure, specifically type 2 respiratory failure in a COPD patient, because they're at higher risk for retaining dangerous levels of carbon dioxide. Moving on to labs, I would want to do a complete blood count, check for leukocytosis or secondary polycythemia from chronic smoking. Additionally, I would want to do a CRP for an infection baseline and then keep assessing the trending CRP during her admission. I would also want to assess for urea and electrolytes to check kidney function before administering antibiotics as baseline. And importantly, I would want to do a sputum and blood culture to help me really isolate the microorganism.
Amazing work. What about imaging? What would you do?
As for imaging, I need to do a chest x-ray. That is a non-negotiable in this patient. Any patient with a cough lasting more than 3 weeks or suspected pneumonia needs an immediate chest x-ray to check for active consolidation or even hyperinflated lungs. As for the special tests, this I would do later on once my patient is more stable and ready for discharge. I would like to do spirometry testing to confirm the obstructive lung disease pattern.
Amazing. Let's talk a little bit about the x ray. Let's say it comes in and it shows blunted costophrenic angle, indicating a pleural effusion. How do you classify the causes of pleural effusion in an OSCE?
Okay, so pleural effusions can be classified as either transudative or exudative. Transudative cause are usually systemic fluid backups like heart failure, renal failure, nephrotic syndrome, or liver cirrhosis. Whereas on the other hand, exudative causes are localized inflammatory or malignant processes such as TB, lung cancer, parapneumonic effusion, or even autoimmune diseases like rheumatoid arthritis or SLE.
Great breakdown. And earlier, you also mentioned doing spirometry. What specific spirometry result confirms the diagnosis of COPD?
So we would be looking for a post-bronchodilator FEV1 over FVC ratio of less than 0.7, which would prove that there's irreversible airflow obstruction.
Perfect. Now the clock is ticking in the ER. Our oxygen saturations are dropping. How are you managing her acutely?
I'd like to use the ABCDE approach. For airway and breathing, I would start her on supplemental oxygen, but with a caveat. I would watch out for the classic COPD trap and not over oxygenate. Our target saturation is strictly 88 to 92% via a Venturi mask at first, to avoid knocking out her hypoxic respiratory drive. So once we get the ABG result and it shows severe respiratory acidosis, we would immediately escalate to non-invasive ventilation, like a BiPAP machine.
Amazing. That was a crucial safety point that examiners will usually heavily penalize you for if you missed it. As for medications, what would you give our patient?
I would give her nebulized bronchodilators such as salbutamol and ipratropium, as well as systemic steroids like oral prednisolone or even IV hydrocortisone in order to bring down the airway inflammation. Finally, because she has an increased in quantity purulent green sputum, I would immediately want to start her with empiric antibiotics, typically coamoxiclav combined with a macrolide like azithromycin for infective exacerbations of COPD.
Excellent acute management, Alina. Now, let's fast forward. She has stabilized, she's moving around the ward, and we're preparing her for a discharge. We can't just send her home with the same blue puffer that she threw out. What is your long-term plan for our Lina doe?
First, we need to address inhaler technique and compliance. We need to step her up to long-acting maintenance inhalers like a LAMA or LABA and ensure that she understands the difference between a rescue inhaler and a daily preventer. After that, we need to update her flu and pneumococcal vaccines, but the single most important intervention that we can do in this patient, more effective than any medication we can prescribe, is smoking cessation. We need to help provide counseling and nicotine replacement options for our patient.
Amazing! That was a perfect run through. We covered our history, investigations, and acute management, as well as discharge planning for our patient. You definitely passed this OSCE station. And that wraps up our clinical debrief for today's case of an acute COPD exacerbation. If you found yourself mentally answering those differential questions, alongside us, you're building the exact muscle memory you need for the wards.
To help you lock in today's respiratory frameworks, we've uploaded the full written transcript, the COPD exacerbation management checklist, directly onto our Discord hub.
Whether you are an IMG preparing for your board exams or a brand new intern trying to survive your first night shift, the Discord hub will be our new launched medical resource hub.
If you found today's clinical compass helpful, please leave us a thumbs up and share this episode with your co-residents and medical friends. It helps us keep the foundation growing and free for trainees everywhere.
Till next time, keep studying the frameworks, watch out for those red flags, and always remember,
Trust the compass.
the compass.
See you on the wards, doctors.